Welcome to the Global Health video class. My name is Dr. Olivia Barracochia. I'm the President and CEO of Realizing Global Health. You can find us at realizingglobalhealth.com, and you'll learn what we do, how we do it, and how we might be able to help you. But today I'm here to talk about rights-based approaches to global health. I told you about my book about rights-based approaches to public health and how we looked at how public health programs can really advance the human rights agenda, particularly the right to health, the right to development, the right of children, the rights of women, the rights of people with disabilities. It's very important that we all understand what human rights legislation is, international legislation to which most of our countries have been signatories and to which we have the responsibility to find ways to fulfill, to protect, to respect. And last time I talked about General Comment 14, and this is a very important document that I hope that you took the time to read this week with your team, and that you have had a chance to think, okay, why can I apply? What is at least one thing that I can apply? One little shift that I can take, changing paradigms that I can take this year in 2015, and I'm sure that will help you really advance. Instead of keep going in this way, make a little shift, a rights-based shift that will allow you to really start making a big impact to help realize the highest standard of quality of healthcare for everyone, everywhere, every day. And today I want to talk about another declaration, another international document which I think everybody has to read to. It's also about 10 pages long. It's the Declaration to the Right the Declaration of the Right to Development. The right to development is as opposed to the human rights. It's a declaration that declares a collective right. As a species, we have the duty, we have the responsibility, and we have the right to development. We have to have the opportunity to participate in our development. So if you read that document, and I suggest it again, you print it, read it carefully, read it along aloud with your team, and think, what is it from this declaration that we can apply in 2015? And you will see that either if you are working in the government, working in a donor organization, or if you're working for civil society, for the private sector, for an NGO. There's many NGOs that are working in global health. How can they look at their programs from the perspective of the right to development? It's a very simple document, deceivingly simple, but it has so much wisdom. And you'll see that if we looked at just some of the articles and we looked at ways that we can apply that in our work, I'm sure we would really develop much faster, because we do have the knowledge and the technology to save millions of lives. Now we can treat and prevent most of the diseases that affect human beings. Now is the time to find a way to make that available to everyone, everywhere, every day, progressively. I think if by expanding every year by 10% in 10 years, we would have covered everybody. Imagine if every year we increased by 10% the number of clinics that are improving how they deliver healthcare, if the number of women that are receiving antenatal care, the number of children that are immunized, progressively improvement. If we coordinated a way in which that can happen, we would be developing ways of really addressing the right to development and the right to health of everyone, everywhere, every day. So I want you to think about that this week and think how we can address the inequality, the people in the slums, the people in the hard-to-reach areas, those minorities, people who, because of their conditions, their diseases, have stigma. How can we make sure that their right to health, their right to development is fulfilled, protected, and respected? And next time, we're going to continue talking about rights-based approaches, so don't miss it. See you next time. Bye-bye.